Traditionally, when patients would have crowns done, they'd take a kind of a goopy material that would work as an impression, and then they would have that impression sent to a lab, and patients would get sent home with a temporary crown that often didn't fit quite right or was a little bit uncomfortable, and they would wear that crown for about 2 to 3 weeks, and then they'd come back for a permanent crown after the lab made that crown for them. In our office, we've actually been able to take the lab to us, and that's what CEREC technology has given us. We're able to scan your teeth, and from that scan, we can actually mill a crown that's been customized to perfectly fit your tooth and send you home with the crown the same day. There's no temporary, there's no goopy material that causes people to gag or leaves bad taste. And the best thing is, in the same appointment, you'll go home with your permanent crown. You don't have to come back in 2 or 3 weeks. In my experience doing CEREC crowns, almost all patients prefer it. And the reason why is they're sitting in the chair, they're already anesthetized, they're already numb, and they're comfortable. They don't have to go through a whole dental appointment again, and they get to walk out with their completed crown. And overall, it's just an easier patient experience. They have much more satisfaction from it.